Hi, this is my presentation of our last patient presentation for week 8. So my patient came in with a chief complaint of, well, what he said was, I'm here because I was hit by a car while riding my bike 2 days ago, and I've been feeling some pain since. Patient's a 68-year-old, well-nourished Caucasian male who states he has been feeling some pain on his right side for 2 days after he was struck by a car while bike riding. Patient says he was knocked off his bike but landed on the hood of the car before hitting the pavement. He states he went to the urgent care immediately after on his own and had x-rays done, which showed no fracture. He received pain medication and to follow up. Past medical history, he does have a history of diabetes and high blood pressure. They're both controlled. States he's retired and enjoys getting exercise by bike riding. He has no known drug allergies, food allergies, or seasonal allergies. He does have a history of a past surgery 20 years ago on his shoulder. His current medication is metformin 500 milligrams BID, losartan 50 milligrams, and hydrochlorothiazide 12.5 milligrams once a day. He says he is current on all of his vaccinations, and he just received his flu shot a couple of weeks ago. He reports he lives alone since he and his wife divorced 10 years ago, and he never remarried. He denies any tobacco or e-cigarette use, denies smoking or any drug use. He says he tries to eat healthy, but it is a challenge. States he has not been sexually active for 5 years, has had 4 female partners, one being his wife in his lifetime. His family history, his mother uh, states, or the patient states that his mother was diabetic, but is now deceased, and his father has high blood pressure, or had high blood pressure, and is now deceased as well. He does have siblings. He has 2 brothers who live in other states, and they both have high blood pressure. He thinks one of them is diabetics, but he is not sure. His ROS general, he's had no weight change, weakness, fever, memory changes, nervousness. He occasionally feels anxious and he frequently gets tired. He denies depression or suicidal thoughts. Um, he has difficulty sleeping due to pain on his right side. He says he can't get comfortable. No rash, lumps, sores, itching, dryness. Denies any bleeding or excessive sweating. Denies heat or cold intolerance. He has mild bruising on his right side of his thorax. His head, he denies any headache, no head injury, no dizziness. He says he was wearing his helmet when he fell. His eyes, he has no vision changes. He does not use corrective lenses, no pain, redness, or excessive tearing, no double vision, blurred vision, or any blindness. His ears, he's had no hearing changes, no tinnitus, earaches, infection, or discharge. His nose, there's no epistaxis or sinus pain. His throat, no neck or throat injury. Um, no lumps, swollen glands, goiter, pain, or any neck stiffness, no syncope, seizures, weakness, paralysis, numbness, tingling, tremors, or involuntary movements. He's or no dizziness. He does say he has occasional headaches. Um, Cardiopulmonary, no shortness of breath, wheezing, or any chest pain. His peripheral vascular, no leg pain, cramps. He does have pain on the right side of his abdomen. No flank or back pain. No pain in his arms or legs. No cold numbness, pallor in his legs. No swelling in his calves, feet. No color change in his fingertips, toes, or swelling or redness or tenderness on any of his extremities. His vital signs are within normal limits. His BMI is 25.1. On examination, his skin is natural color, warm and smooth and dry. Good skin turgor, no lesions or rashes. His nails are without clubbing or cyanosis. He does have mild bruising on his right side of his torso. His eyes, no periorbital swelling or erythema. Extraocular movements are intact and conjunctiva is pink and moist. Sclera is clear of excessive tearing. I'm sorry, ears, there's no exudate noted. They're clean. Tympanic membrane is seen, pearly gray with a cone of light bilaterally. Septum is midline, nasal mucosa is pink, moist, his inferior turbinates are pink, there's no redness or swelling noted. His throat, his oral mucosa is pink, tonsils are grade 2, neck non-tender, cervical, no lymph nodes palpable. Patient is not complaining of any cervical neck pain. Neuro, he's alert and oriented times 4. His thorax and lungs are symmetrical with good expansion. His respirations are even and unlabored. No use of accessory muscles, stridor or grunting or nasal flaring. His lungs are resonant. Breath sounds are clear. No crackles noted. There is mild bruising on the right side of his thorax, and it is tender upon palpation. Cardio, without bruise, regular heart rate, without any clicks or murmurs. Extremities are warm without edema. He is musculoskeletal. He has mild to moderate muscle joint pain and some joint stiffness on his right side. GI, he has no nausea or vomiting, and he says he's had a normal appetite. His differential diagnosis is he probably has a rib fracture, chest wall or chest wall contusion. He is rating his pain at a 5 out of 10. He complaining of insomnia due to the pain and anxiety due to the accident. And he was hit by a car and he ended up on the hood of the car before he hit the pavement. The plan for him is to have x-rays. He needs x-rays of his head, x-rays of his chest, his cervical spine, his abdomen and pelvis to rule out any fractures due to his age. The good thing is that he said he was wearing his helmet. He does need labs, and they will include CBC to detect any anemia. He probably has a rib fracture, but I'm going to wait for a confirmation from the x-ray, although probably wouldn't treat it any differently than the prescription that he's going to be given today. He needs pain management. So he was prescribed Norco, 1 tab every 4 to 6 hours, PRN pain. He needs to be monitored. So the patient's going to come back in 2 weeks or sooner if no improvement. He was encouraged to do some deep breathing exercises. He is going to walk as he's able to keep the circulation going and get some rest as he needs. Patient education is going to encourage fluid intake, healthy diet to promote recovery, take his prescribed medication for pain control, deep breathing exercises to prevent pneumonia, seek out possible resources that could possibly help him while he's home if he's needing any help with like getting meals or preparing meals, maybe a neighbor or any adult children that could come and stay with him while he is recovering. He is to come back in a couple of weeks, and then we will discuss the results of all of the lab work and the x-rays, and then make a follow-up plan from there. All right. Thank you so much for watching my last patient presentation. This class has been amazing. Thank you. Bye.